Welcome back. One final point before we go tonight. We've all heard the models predicting that 4 million Americans are going to die from coronavirus. We now hear a growing number of scientists questioning whether COVID-19 is any worse fatality-wise than the flu. But how do we know for a fact how serious COVID-19 is? We need to know because these projections are informing political policy that has already cost over 3 million Americans their jobs in the past week. According to Dr. Jay Bhattacharya of Stanford Medical School, there is a way to tell for sure, not based on assumption or modeling, prediction or projection. Dr. Bhattacharya says the answer is antibody tests on random samples of the population. Antibody tests identify in your blood, it's a finger prick test, whether you've ever had COVID-19 versus the tests that only identify whether the virus is currently active in your system. If we know the true number of people who have ever been infected, then we can calculate the true case fatality rate and how serious this really is. And we can use the true case fatality rate to inform our political policy more wisely. There's no other way to know what's coming, whether our hospitals will be overwhelmed or not, whether 10,000 people will die or 8 million people will die. Anybody who tells you they know for a fact is lying. Nobody knows for a fact because what we're dealing with, we don't know what we're dealing with because we don't have the data to know. Dr. Bhattacharya says these randomized sample tests are not hard to conduct. He says the antibody tests are already available. I talked to him yesterday and he said, if this is done correctly, we could have this data in a matter of weeks. Why aren't we doing this? Why isn't this a priority for state and local governments, for the Trump administration? It's tragic, of course, when anybody dies. But if we are facing a virus that kills 10,000 people, we don't shut down our economy for that. 50,000 Americans die from the influenza every year. According to Bhattacharya, there's compelling evidence to think the incidence rate of COVID-19 in the United States, which means the number of people in total who are and were infected, may be way higher than we think. He wrote this in the Wall Street Journal on Tuesday, and I quote, "The epidemic started in China sometime in November or December. The first confirmed U.S. cases included a person who traveled from Wuhan on January 15th, and it is likely that the virus entered before that. Tens of thousands of people traveled from Wuhan to the U.S. in December. Existing evidence suggests that the virus is highly transmissible and that the number of infections doubles roughly every 3 days. An epidemic seed on January 1st implies that by March 9th, about 6 million people in the U.S. would have been infected. As of March 23rd, according to the CDC, there were 499 COVID-19 deaths in the U.S. If our surmise of 6 million cases is accurate, that's a mortality rate of 0.01%, assuming a 2-week lag between infection and death. This is 1/10 of the flu mortality rate of 0.1%. Such a low death rate, he says, would be cause for optimism." End quote. Now, Bhattacharya could be wrong. His model might be wrong. New data next week could come in and prove that his whole theory this week is wrong. How do we know? Randomized tests of a population sample to learn how many people have been infected so that we can calculate the actual death rate. So we can figure out how to stop the spread of COVID-19, protect our vulnerable populations without throwing millions and millions of Americans into economic devastation. Send this to your policymakers. Tell them you want random sample population antibody tests.